Welcome to the Thrive on Plants podcast, the podcast where we explore the power of plant-based living for vitality, longevity, and overall well-being. I'm your host, Dr. Daphne Bascom, and today we're diving into a topic that affects so many of us, gut health and food reactions. Have you ever wondered if that bloating, that brain fog, the fatigue after meals is a sign of something more? Or have you been confused about the difference between food allergies, food intolerances, and food sensitivities? Well, today we're going to clear up the confusion and empower you with the knowledge to take control of your health. Joining me today is the amazing Dr. Erin Sinnaeve. Erin is a family nurse practitioner with nearly 3 decades of experience spanning the US Navy, primary care, allergy and immunology, and she's also board certified in lifestyle medicine. Erin spent the last 8 years specializing in allergy and immunology in the Chicago area, and she's also an educator teaching population health and epidemiology at Chamberlain University. But I think what truly sets Erin apart is her passion for health equity and advocacy. I actually met Erin through the American College of Lifestyle Medicine, where we were both involved in the Health Equity Achieved Through Lifestyle Medicine initiative. But Erin likes to ensure that all people, regardless of background, have access to effective and science-based healthcare strategies. So she's here with me today to break down the science, to bust some myths, and to give us a practical, plant-focused way to support our gut health. Erin, welcome to the Thrive on Plants podcast. I am so excited to have you here. We've been working together for so long, and you've had such an amazing opportunity to educate our community that I'm excited to share with a broader audience all the wonderful things that you've been teaching me.
Well, thank you. I'm thrilled to be here and honored that you invited me. As always, I love chatting with you and I learn from you all the time. So thanks for having me.
Well, I want to start with some myth-busting quick-fire questions. These are all going to be true, false. I know we're going to touch on all of them during the course of our conversation, but you can answer just true or false, no long sentences. I kind of stole this from the Zoe podcast, which I love to follow.
Oh, I love that. Yes, that's a great podcast. Okay, I'm ready.
Okay, first question. A single medical test can diagnose all food intolerances, true or false?
False.
Everyone benefits from a gluten-free diet, regardless of celiac disease status.
False.
Regular exercise significantly alters the gut microbiome.
True.
Plant-based diets can help reduce symptoms for most common food allergies.
True.
At-home food sensitivity tests reliably identify all food sensitivities.
False. In
Wonderful.
all caps.
In all caps. Exclamation points after
that. Exactly.
Erin, I know a lot about you, but I would love for you to share a little bit with our community about your vegan journey, about how you became an expert in allergy immunology, and also being board certified in lifestyle medicine.
Okay. Well, I became a vegan or whole food plant-based, probably about 13, 14 years ago. And after a lot of people, kind of the same thing happens. They watch a documentary and they're like blown away by the evidence on, diet and health, right? So that's why I went whole food plant-based. And I've been a nurse practitioner for a long time now, since 2008, and I've worked in a variety of settings. I've spent the last 9 years of my career working in allergy immunology. And I went into allergy immunology because I'm interested in respiratory disease, right? Like, asthma, allergies, because so many people are affected, and food allergy is just fascinating to me and I love it, and eczema. So that's why I really went into allergy. But I noticed, however, that about 10% of my patients that were being referred to me were people with suspected food allergy / intolerance, and people were coming into me with abdominal bloating and gas and GI complaints. And so I and I always felt kind of helpless at first, like, gosh, this is not my area, right? Have you seen GI? And I think that's what a lot of even primary care are like, oh gosh, you're bloated, you should probably go see GI. A lot of people are sending them also to allergy. So I felt like this population has not been being served well, that people have a lot of bloating and GI complaints, and there's, a lot of lack of evidence in some ways. And so I felt a sense of responsibility to start to kind of really dive into the evidence and the research around food intolerance and just dysbiosis and GI complaints in general. So that's kind of how I took an interest to that, just because I was seeing a lot of patients with these complaints.
Awesome. And so what is the difference? I mean, what's the difference between a food allergy, a food intolerance, a food sensitivity? Because I think that there's just from social media, I feel like it's all jumbled together.
Yeah, that's true. Well, let's talk about food allergy first. So food allergy involves the immune system, and the body develops an immune response reproducibly on exposure to a given food. So reactions typically occur within minutes, rarely beyond 1 to 2 hours of eating the food. And symptoms can often involve vomiting, hives, swelling, respiratory distress, and a systemic reaction called anaphylaxis. The treatment is epinephrine. So typically these patients come into me in infancy or toddlers after having kind of tried these foods the first or second time. That's usually how people are presenting with food allergy. So if someone is eating a food and not having these reactions reproducibly every single time they eat the food, they do not have food allergy. Food intolerance. Okay, so that does not involve the immune system. Typically, this is difficulty with digestion. So lactose intolerance is probably the most common that you hear about and I hear about. Lactose is a simple sugar that is found in dairy products, and people with lactose intolerance, either temporarily or long-term, cannot break down those enzymes. They lack the enzymes to digest lactose, essentially. And so it passes through the GI tract and causes all sorts of problems like water being sucked into the bowel, and they can get bloated and gassy. Oftentimes the symptoms occur the next day, sometimes diarrhea, sometimes constipation. That's sort of food intolerance as opposed to food allergy.
And what about someone who just comes in and says, I'm sensitive? Is that in a spectrum of intolerance?
Well, so
Or is
food
that marketing?
sensitivity, right? Yeah, it is. You're right. I mean, and just like you, right? We like to, learn about everything as it pertains to health from an evidence-based standpoint. And for the life of me, I cannot find a consensus medical definition of food sensitivity or what constitutes food sensitivity. And even the major governing organizations like the Quad AI in the United States and the organizations in Canada and Europe that govern like guidelines around food and food allergy, they don't have a definition for food sensitivity. And there's no diagnostic tests for food sensitivity, which I suspect we'll chat a little bit about later. But if you go online and you search it, it'll take you 10 seconds to find all these tests that you should do to find out if you have food sensitivity. So anyway, that's a problem, right? So food sensitivity, there's really no definition for it. Some people will say though, gosh, I'm sensitive to red wine. And I will say, like, if I drink red wine, I would get migraines. Maybe that's a food sensitivity. There's some sort of potential chemical reaction that is happening. But again, there's no medical consensus on what food sensitivity is.
Interesting.
Yeah.
So a lot of it is how that's being marketed or discussed in kind of the lay press, the social media, everything else.
For sure. I mean, and people will go online because they're desperate, right, for answers. And so if somebody tells you, gosh, take this test and you're going to know what you should avoid, then of course people are tempted to do that, right? And if it were only that easy, I wish it was that easy. It's just not, unfortunately. So
And you mentioned too that, I mean, part of it makes sense to me as you're talking about what an allergy is or what an intolerance is, that it may not just be gut related. So whether you're having bloating, whether you're having fatigue, whether you're having some skin issues, are these also tied into, could they be related to a food intolerance or food allergy?
Well, Potentially, I guess. Yeah. I mean, people have a lot of come in with a lot of generalized complaints like that. Yeah. And it'll be like, I'm fatigued. And so it part of the evaluation is, gosh, yeah, let's go over what you are eating and what's happening. But also, do you potentially have an underlying thyroid disease or thyroid disorder or autoimmune condition? Are you going through menopause? There's potentially multiple factors, and it's not always just the food. But as we get into talking about gut health, I think we'll find that you'll so much of our overall health is related to our gut and tied to our gut and what we eat. But again, do not suspect one or two foods to be typically causing most people's chronic fatigue syndrome or what have you.
Then let's dig in. Let's talk about gut health, because I
Okay.
do think it's the nexus of so many things that, and not just food allergies or food intolerances. When you're thinking about gut health, can you start by talking about what is meant by the gut microbiome? And then when you're saying a healthy gut or dysbiosis, what does all this mean in the context of you evaluating someone walking into your office?
Okay. Well,
It's a
yeah.
lot, I
So
know.
that is a lot. That's a ton of questions, but that's okay. I mean, that's why we're here, right? So I guess what is the role of the gut microbiome when we're talking about digesting food, right? The gut does play a crucial role in food digestion. I mean, obviously that makes sense. And what it does is it breaks down complex carbohydrates and fiber, which produces, essential nutrients like short chain fatty acids that, like acetate, propionate, butyrate. You may hear those terms on, different gut health podcasts, but they're important as sources of energy for the body, particularly for the cells lining the gut. And so, what we eat does matter, right? And so, when someone says the term dysbiosis, right? Dysbiosis can be defined as through the loss or gain of bacteria in the gut that either promote health or promote disease. And so, as a result, sometimes when someone has dysbiosis, meaning an imbalance, the beneficial bacteria are fewer typically than the harmful bacteria, right? And it's this dysbiosis is linked to impaired gut barrier function. I think we talked about how the GI tract is one cell thick, and so we have those nice tip in a healthy gut, nice tight junctions between these cells of the gut lining. But when you have dysbiosis, you see that those cells become separated, and so these junctions open, food particles and toxins can leak out into the peritoneum. They call that leaky gut, and cause symptoms like increased inflammation and bloating and diarrhea or constipation in some cases.
And that's a wide variety of symptoms.
Mm-hmm.
What do you think? So when we're thinking about dysbiosis, leaky gut, are you are you seeing more of this related to people who are eating more ultra processed foods? Is it as common in people who are whole food, plant-based? Or,
Yeah.
I mean, I feel like there's probably a spectrum of community members that you see. And what's
Mhm.
been your experience?
Well, I think, yeah, we know there's so many things that can impact the gut, whether it is ultra processed foods, whether it's chemicals in our food, whether it's the impact of medications. And so I always like to lead with, there's multiple reasons that the gut microbiome could be out of balance. But the most important thing is we know that one size doesn't fit all. And I always start with, gosh, do you have a history of some medical problem? Is there celiac disease? Is there inflammatory bowel disease like Crohn's? Or, do you have something else going on? We want to rule those things out. So I always recommend talking to your primary care provider or seeing gastroenterology. But if those things are ruled out, right? And we know celiac disease affects 1% of the population. So that's where you do have to avoid all gluten, right? But if those things have been ruled out, I do think we have to think about a few different categories like food, right? Is it a food issue? Again, is it an anatomical problem like we talked about? Is it hormones? Is it habits you have going on? Is it something you're taking, a medication you're taking? So I think, and there's multiple potential causes, and there could be, of course, like multiple reasons you're bloated. And I don't know that we have time to talk about all of them, but I do think it's important to talk about a few of them for sure. And so, let's talk about the medicine cabinet first, right?
Yes. Yep.
Antibiotics,
That's a
right? I
big
think
one.
that that's important
Yeah.
because, medications you're taking daily, or you know, in courses like an antibiotic course. And if you have taken an antibiotic and you've noticed you've been nauseous or had diarrhea after a couple doses, antibiotics are doing the thing. They're doing the right thing by killing those pathogens that we want them to kill, but they also indiscriminately kill off huge numbers of good bacteria in your gut. And it takes a long time to get those back. So if you're taking an antibiotic, make sure you're taking one for the right reason and question your provider. And just, I'm a provider. I prescribe antibiotics, but I really try to be careful about, is this appropriate, right? And have we done the other things we can do? So, but we know that the undesirable bugs get in there and multiply, and then we end up with dysbiosis for a long time after an antibiotic. Another medication I think is important to talk about are PPIs. Those are acid suppressing drugs. And if you've been taking one of these, they work if you have acid reflux or gastritis, and but it blocks acid. And stomach acid is an important part of digestion. And so when you block stomach acid with PPIs, you create maldigestion and interfere with the natural sort of gradient in your gut. And this can result in bloating. So if you've been on a PPI for a long time, I generally say, certainly let's get to the root of why you're on this, and certainly talking to your gastroenterologist or your primary too about that. And yeah,
PPI means proton pump inhibitor. Yeah.
that's right. Yeah. Like omeprazole,
Omeprazole.
pantoprazole, a lot of those. Yeah. And a lot of people are on them for years and
So
years
the
and years.
heartburn
And so
medicines.
it's the heartburn medicines. Yes. And so, and then NSAIDs. That's, I think, another one that we should, just touch on.
Yeah.
High doses of NSAIDs. So that's like ibuprofen, Advil, naproxen, those medications. They can alter the microbiome as well. And they think that this is likely due to prostaglandin synthesis and we know prostaglandins help maintain mucosal integrity of the gut, and the regulation of immune responses. And so their disruption can certainly lead to gut permeability and inflammation.
So you just outlined three big categories of medications that a lot of people take.
Yeah.
Your acid blockers, your proton pump inhibitors for heartburn, your antibiotics. And I mean, this is impacting you whether you're taking antibiotic as a young person or as an adult. And then your nonsteroidals, your just over-the-counter pain, fever reducing medications.
That's true. And these are essential sometimes, right? And so, but I think taking them regularly and is not an ideal scenario for the gut, for sure, and for our overall health in general.
And so how does someone balance then? And I love the fact that you mentioned let's get to the root cause, whether it's heartburn. How do I get to the root cause so I don't necessarily have to be on a proton pump inhibitor for forever? The same with, I had 8 weeks of antibiotics. And the interesting thing is my infectious disease doc actually asked me, are you taking a prebiotic and a probiotic? So for people that need to take these medications, either as a short course or as a longer duration form of therapy, are there things you recommend to help reduce the impact on the gut microbiome?
Yeah, well, I do. And I generally always start with food, right? And I think, and this is standard for really everyone, I recommend a good variety, diversity of plant foods, right? High fiber plant foods, fruits, vegetables, whole grains, legumes, nuts, seeds, the plants. So that's got to be the baseline. But then when it comes to supplementation, if somebody is on antibiotics, short term or long term, I'm typically recommending probiotic. And now prebiotics, they're kind of starting to gain more momentum, and certainly look at there's a lot of great GI doctors out there talking about them, but prebiotics, probiotics, and now there's even postbiotics that are, there's so much in the supplement, which, supplements aren't regulated, so we don't know exactly what's in there. But I do think in these scenarios, it is good to be on a probiotic for sure, at least for I would say even 2 to 4 weeks after finishing an antibiotic course. And if you are on a PPI long term, absolutely, I would be taking a probiotic because, don't take it at the same time as your PPI because you want to
Right.
make sure it gets absorbed. There's those sorts of factors, but I do think that in that case, supplementation is likely a good idea.
And these aren't things that the pharmacist even talks with you about when you're
No.
picking up the medications. Yeah.
Yeah, I think they don't because I mean, well, pharmacists are so busy anyway. I just feel like they're just nonstop, and
Yep.
it's I mean it's how it is. But I think you're right, and I feel like even given this industry isn't well regulated and there's not a lot of guidelines around yes, every time you give an antibiotic, you should be on a probiotic. It's hard. It's hard, and people don't always necessarily recommend it. And people, unless you're keeping up with the evidence on the
Mhm.
regular, and they can, then maybe they're not recommending it. But it is definitely something that can help get that dysbiosis to resolve and get a better, the good bacteria to multiply again, is to get those supplements in there.
And one other class, and I know it's not a medication, but something that I get a lot of questions about, and our coaches do, are artificial sweeteners. Do they fall into that
Mm-hmm.
category of food-like substances that you notice people are having either intolerances
Mm-hmm.
or sensitivities to?
Yeah, I think that's a good point to kind of bring up the second category, right? Food, and it is a huge category. Or artificial sweeteners aren't necessarily food, right? They're artificial sweeteners, and sugar alcohols is another one. They're not actually food, but they're a non-nutritive edible food-like substance, right? To make things taste sweet without getting the calories from sugar, I guess. Although the evidence on like going from regular Coke to Diet Coke, it doesn't show people necessarily lose weight. So it's just so you know what I mean. I think these artificial sweeteners, they're finding that they can cause lots of bloating. Because they're not absorbed in the small intestine where most food is absorbed, and they
Mhm.
end up traveling down to your colon where they get fermented by the bacteria in your colon, and that causes gas. And so the evidence seems to suggest that artificial sweeteners really do alter the microbiome.
Interesting. And yet,
Mhm.
how pervasive are they?
Yeah, they're in everything.
Yeah.
They're in everything. And, yeah, there's all different, multiple different kinds. And so you have to really read the labels. Anything that says sugar free, I always am a little bit suspicious, and I always want to check the label, or zero sugar, or you know
Mhm.
what I mean? So that's anything packaged that says something like that, it's good to make sure it doesn't have artificial sweeteners, or, I think it's a good idea just to avoid them.
And Erin, you mentioned three terms and want to break down to prebiotic, probiotic, and then you mentioned postbiotic when you were talking about your short-chain fatty acids, your propionate butyrate acetate. But if someone's listening who is on an antibiotic course, if they are taking NSAIDs for because they're doing one of my
Mm-hmm.
workouts and they're
Mm-hmm.
chronically in some
Mm-hmm.
discomfort, are there prebiotic and probiotic foods that you tend to recommend in order to mitigate some of the effects of the meds?
Yeah, I mean, there are, and well, I guess should we talk about the difference between prebiotic and probiotic?
I was hoping you would.
So, all right. Um, Prebiotics are from food, right? And they are foods that have fiber, okay? And they have often resistant starches and polyphenols, okay? And these are prebiotics. And so there are a lot of good prebiotic foods, things like bananas and asparagus and
Yeah.
apples and onions and garlic and leeks, and oats are good too. So there's a lot of good prebiotic foods, and they become the source of food for our probiotics, right? And probiotics are things that contain live active bacteria. So the most common example are fermented foods. So you think about things like yogurt and sauerkraut and kimchi and miso and tempeh, those are all good sources of probiotic foods. And then, of course, there's supplements, right? So,
Yeah, but
yeah.
don't always know what's in the supplement.
That's right. You don't know always what's in the supplement, and they're not always well regulated. Now, that doesn't mean they're all terrible. They're not all bad. And like I said, if somebody's on an antibiotic, I do typically recommend them while they're on the antibiotic and afterwards. But I think it's best to start with food always.
And some of the probiotic foods you mentioned are also high FODMAP foods. So those could also maybe cause some GI discomfort, or if it's someone who's sensitive.
That's true. I think FODMAPs are, a lot of people will go on a low FODMAP diet because of bloating reasons,
Mhm.
right? And they're in their primary care, someone will say, yeah, go on a low FODMAP. So what are FODMAPs? That stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols.
Yeah.
Okay, to just throw some really easy terms out there. Anyway, but it's the fermentable part of our food that our gut microbes have the potential to turn into gas. So things like fructose, which is found in fruit, and lactose found in dairy products, and galactans found in legumes, fructans found in gluten-containing grains. So sometimes when people say I'm gluten intolerant, they're actually fructan intolerant.
Mhm.
So you always have to kind of look at what you're eating alongside of the food that could be causing you issues. And then polyols are what's found in artificial sweeteners. And
Right.
so these are, so sometimes people will go on a low FODMAP diet and feel better because they've eliminated all of these foods. But it's not meant to be a long-term diet, right? It's
Exactly.
meant to be like, okay, let's take these out of our diet and then let's reintroduce to see if something is causing me issues, or if it's just my gut microbiome needing some healing.
And do you see a lot of patients coming into your clinic? Because we see a lot of it in our coaching program, where people have come in on a restricted diet because someone has told them you can't eat these foods. Um, and so, I can't eat asparagus, I can't eat bananas, I
Mhm.
can't eat X.
Yes. Oh
Um,
my gosh. I do. I see it all the time, and I will see it in the Epic EMR, and they'll have 20 foods listed under their allergy list. I'm
I'm like,
like,
oh no.
they'll put it on their allergy list. Like, yeah, I can't have these foods. And then it's a matter of just like really breaking them down one by one and talking about what happens and who told you this and why do you think this? And oftentimes it will come down to, oh, I took a food sensitivity test, and that's why I was told I can't eat these foods. And they'll be, and that whether it's placebo or not, sometimes people be like, and I just feel so much better, and so I'll be like, well, are you getting the nutrients you need every day, right? And are you asymptomatic? So it's sometimes there's a lot of undoing and unnecessary restriction that happens. And so it's a lot of education and then reintroducing foods, because yeah, I don't love it when people are on these super restrictive diets for multiple reasons, right?
Mhm.
And then it can lead to, again, disordered eating and a lot of unnecessary avoidance.
And Erin, I love data, but can we chat a little bit about some of these tests that, I mean,
Yeah.
you mentioned earlier that if I went into Google and typed in food sensitivity, I could probably order 10 different tests very quickly. But could
Mhm.
you, from the perspective of just orienting the community around what type of testing is valid and of
Mhm.
value, and then what type of testing may not be high yield? And then, sorry to layer this on, the third question really is, when you have this data, how do you actually interpret it? Because a
Mhm.
lot of the home tests, a lot of the send away tests, I don't know that people understand, what do I do with this when I receive a result?
That's right. Okay. Well, for food allergy, we do have valid and reliable testing.
Mm-hmm.
The most important thing is the patient history. What happens when you eat a specific food, right? That's always number one. And if someone comes in suspecting they have a food allergy, first of all, I'm finding out what type of reaction they had, all the history, and then they'll be, if they say something to the effect of, yeah, I eat it every day, but this happens to me. I'm like, well, you don't have a food allergy and there's no reason to test for it. So, but we do have, for those people that are allergic to the top, 95% of food allergies, the top nine, right? So milk, eggs, soy, wheat, fish, shellfish, sesame, oh my gosh, soy, and I forgot one, but anyway, those are the top nine. And so that's the vast majority of food allergy. And we have great skin testing, where it's called IgE testing, and we
Mhm.
have blood work we can do, IgE blood work. And so I do check those in patients that have classic food allergy and have to carry their EpiPen, and the reaction happens reproducibly. And on those patients, you'll see elevations. Now, even with IgE testing, is the potential for false positives. And anybody that's an allergic person, whether they have allergic rhinitis or asthma, and if they're allergic, they'll have higher circulating immunoglobulin E in their blood. So we will see false positives. So I do have a number of patients that will come in after having IgE testing, and they'll be like, look, milk came up positive, or egg came up positive, or peanut, and I've been eating this. And I'm like, that's a false positive, because the best test is an oral food challenge. And if you're eating it, you're not allergic. So I always recommend against IgE blood work in most patients outside of the allergy clinic, because again, it does lead to avoidance. And in people that
Mhm.
are sensitized, if they have a history of eczema, they could, if they stop eating a certain food, they could develop an allergy later. So it is very nuanced, I realize, but but that is the testing we have for classic food allergy. Now, as you mentioned online, you can buy certain tests called IgG food testing.
Right.
I never order these in the clinic because they're not covered by insurance, because they're not valid or reliable. So these are not valid or reliable tests. I'll just put it out there. It's a waste of money. Anyway, and again, that's a big misconception. You can do a little blood test or a hair sample or saliva or a muscle biopsy test, and someone can tell you what foods you're quote unquote sensitive to or intolerant to. And trust me, healthcare providers order these tests. I've seen it come. I've seen people bring in paperwork that they got from whatever provider they saw on the outside. So I don't, and so I understand why people are confused, because
Mhm. Mhm.
some providers are ordering them, as well as you can buy them online and spend $200 or $300. But I would urge anyone listening to never, ever, ever order or take a IgG food test. Testing, because again, there's no proven test to figure out what you're sensitive to or intolerant to, and food intolerance doesn't activate your immune system, and so you're not going to get any results. These results really mean nothing. And IgG is a measure of tolerance. So likely, if you've eaten the food, you might have an elevation. So we
Right.
don't know how to even interpret those.
And do you think any of the microbiome tests can accurately also help people discriminate foods that they may be allergic to or sensitive to?
No, I don't think that that's going to, in a word, I don't think that those tests are necessarily all bad.
Right.
Is that I think the evidence is evolving around testing the gut microbiome, and they're doing lots of research. And I'm even in food allergy, they're doing research, and they can sometimes test the microbiome in infants and tell if they're going to potentially be an allergic kid or not an allergic kid. There's different tests you can do. And from a stool sample study, but again, I think the jury's still out on validity and reliability of those. And so and I do have patients come in and say they had their microbiome tested and they got put on a very specific prebiotic or probiotic medication or supplement, and they feel better. Granted, those are
Mhm.
not, that's what I hear in my clinic, but I'm not seeing a ton of evidence on it just yet. So I can't just blanket recommend, testing the
Right.
stool at this point. Yeah.
And it's funny because we had Dr. James Marin come chat with us last week. And one thing
Mm.
he shared is that your microbiome is probably going to be most similar to the people that are most closely in your circle, whether it's your husband, your partner. So thinking about that, if you have a spouse, a partner, family members that you live with who have, how does their microbiome or your proximity to them potentially impact your own food intolerances or allergies? Because you're that implies that our microbiome is not static and that it's changing over
Hmm.
time.
hmm I think, yeah, that is what the evidence is showing too, that like they'll take even, I listened to a podcast the other day and they took like identical twins and they lived in different states and their microbiome was completely different, right? And it was most similar, just like you mentioned, to those around you, because I suspect is because we are eating the same type of diet
Mhm.
that those living in our same household are living in, and not to mention the environment, and we're doing the same activities. We know nature is really important for the microbiome, and exposure to the soil and to nature can actually alter our microbiome. So if I'm going out hiking twice a week with my husband and we're eating the same foods, it would make sense that our microbiome is composed the same way or similarly, right? And so that's it. That is, what they're finding on the research too, is that your microbiome is very much similar to who you're around. Yeah,
Yeah, which it's
yeah,
fascinating.
it is.
Erin, one topic that I would love to get your feedback on, because I spend a lot of time talking with women who are in perimenopause, in the menopause transition, or postmenopause. How does menopause, and that's a full spectrum of 20 plus years right there. So it's a
Yeah.
big question, but how does that affect digestion and the gut microbiome?
Well, good question. But I know you did an amazing episode on the estrobolome. Let's just put that out there. And so if you haven't listened to that episode, that was really good. And so but we know estrogen is metabolized in the liver, right? And it's excreted into bile and it gets into the gut. And this is where estrogen is recirculated and excreted. And in the gut, you have this collection of bacteria called the estrobolome. And so if you have a healthy estrobolome, this really just the right amount, it's going to work great and you're going to feel great. But menopause, as we start to approach menopause, we know that these levels of estrogen and progesterone get altered and they decline. Sometimes progesterone decreases more than estrogen. Again, I feel like you're a little bit more of an expert on this than I am, but you can have a little estrogen dominance, right? And this is highly correlated with bloating. I mean, my own menopause journey, I definitely have had more bloating, and I feel like I'm more sensitive to a lot of things, including protein powders and things like that I could used to be able to drink. And, and so I'm trying to stick more with like whole foods of protein and stuff, because we know that can, just hormone imbalances can affect our gut health. We also know that xenoestrogens, like xenoestrogens, so this is things hormones that are found outside, like in animals or cleaning supplies or plastics. We know that can affect the gut microbiome as well. And then I think about too, like stress, of course. We know stress is related to cortisol, and we know that all of that stress disrupts, again, the normal hormone messaging in the gut, and we can, and all of this is related to intestinal regularity. I know when I get stressed, I start to feel a little acid reflux. And so again, I know something is happening in my gut, right? It's going to slow down my stomach emptying. I might get constipated. And so we know, all these things can lead to changes in the gut and intestinal inflammation, intestinal permeability, and all of those things can affect the gut.
Do you think those changes that are occurring, as our hormones are changing, and presumably there's probably also similar fluctuations during our menstrual cycle,
Mm-hmm.
do you think they also can affect our mood and our mental health?
For sure. I mean, I think definitely we know that gut health can affect anyone's mood. And definitely in menopause, which could possibly explain part of, the brain fog and the anxiety and all of those things that do come into place, because there is this thing that is called the gut brain connection, right? We know there is a link between what's going on in the gut and what's going on in the brain, and there's an entire field of medicine that's called nutritional psychology, and it is evolving, and I'm very excited to kind of to keep watching what's going on in that field, because our gut bacteria is in the same environment as 90 to 95% of our serotonin receptors, right? So serotonin is the happiness hormone, and there is serotonin in the brain, but 90 to 95% of serotonin production happens in the gut. So, we know that these things occur also outside our bodies, of course, in our environment, things that happen. The world has got a lot of things going on in it that can affect our mood as well. But we also know that food is involved. We know that gut health is involved because food is being digested where the serotonin receptors live, right? And so food can mediate, I think, emotion. And, for example, if you're primarily eating processed foods, this leads to inflammation in your gut and can disrupt that blood-brain barrier. And studies of inflammation show that people with anxiety and depression also had increased inflammatory markers like C-reactive protein and ESR, said rate. And so all of the food matters, and sugar matters, right? Sugar's like the impacts the dopamine pathways, right? And so people will argue, can we be addicted to sugar or not addicted to sugar? But I think we can in some ways, because we just feel good when we eat that, and it does affect our brain, right? So
Something to think about with the April holidays coming up.
that's right. Exactly. Those Easter baskets. I know. It is interesting though. I mean, I'm seeing more on neurodegenerative diseases like Alzheimer's disease and Parkinson's. And, we know that we don't know what causes neurodegeneration 100%, but we know that, again, that they're investigating the link between the gut microbiome and Alzheimer's, and specific gut microbes being at certain levels of those patients that have Alzheimer's disease. So it is again an evolving science, but I think it's one that we have to keep our eye on, because it's all interconnected.
And thinking about evolving science, you mentioned nature, and I'm excited to see conversations around environmental nutrition. And I know you're an outdoors person, you like to hike, I love to hike. What is the connection between our environment, and that's a broad question, or nature, let me put it that way, and our microbiome,
Yeah.
and just our overall health?
Yeah, for sure. I took a trip recently to Panama. It was the coldest week in Chicago land, and it was like sub-zero temperatures, and we happened to be going to Panama. And and I like my sunlight, and it's hard during these winter months, and this was just in February. And so we went to Panama, and I feel like I got off the plane and stood in the sunshine in the 85-degree weather, and my entire body felt better. I realize this is N of one, but I was like, I needed that sunlight and that warmth and that heat. Anyway, I think again, we don't know how good nature is for us. I mean, I think we do know, but I think from a research place, we're not there. But the evidence that does exist suggests that spending time outdoors can positively impact your gut microbiome diversity, which is, of course, linked to improved health outcomes. And so exposing ourselves to the natural world, like fresh air and sunlight and, skin to nature content, like gardening and being in the soil, it's really the best way a great way to introduce your body daily to large array of pathogen fighting microbes. And they colonize in your skin, but they also make their way into their gut, and you breathe them in and all these things. And so, Dr. Robin Chutkan is a big proponent of like nature and being in the dirt. I think she says that every time she talks on her podcast. She's like, being in the dirt has shown to like really improve mood and fight off depression and anxiety. And even exposure to green spaces has been shown to do the same. So I think being in nature is a really huge way that we can, very low risk way to go out and kind of just improve our overall health.
I mentally and physically, yes.
Yes, mentally and physically, for sure. For sure.
How was Panama?
It was so nice. It was beautiful. Just the people were so warm and kind, and the food was
I was going to say
amazing.
the food, yeah.
Oh my gosh, the plantains are so good. Anyway, it was really beautiful. Yeah. Yeah, it did rain a little bit like every day because it's very tropical, but it was beautiful. And we walked on the waterfront every day, and we went hiking. We went into the woods a little bit, saw some waterfalls, and saw some really beautiful wildlife. And monkeys and sloths and all the things. So it was great.
And perfect to be out of Chicagoland during that time.
That's right. That was like the best week to be gone. Yes, I have to say. So
So, Erin, listening to you raised another question. And if this is not an area that you're comfortable talking about, um, I see a lot of people on social media talking about cleanses now, and which to me makes me think about just washing out all the good. I mean, I can think about if someone has dysbiosis, they're probably thinking, if I can wash out the bad, maybe the good can repopulate. But
mm-hmm.
do you see many of your patients coming in who share, I've had a cleanse, or I've been on an elimination, or I had a colonic? Are
Mm-hmm.
those helpful modalities, or are they modalities that people need to approach with caution?
I would say, I mean, I don't know that there's a lot of evidence on cleanses, to be honest. I think I worry that cleanses, whether, like you said, they're colonics or if they are drinking a product that is just going to completely cause diarrhea, almost like prepping for a
The
colonoscopy, right?
colonoscopy.
I think I worry that those are disrupting the microbiome because it sounds like they do just flush out the system essentially. And so I don't think it's a practical strategy. I don't think it's, I mean, if people are doing it, I think if they feel better, sure, but I would be very careful and watch it for electrolyte imbalances and things like that. I would be worried about. So I'm not a big proponent of healing the gut through cleanses. No, I think I am a big proponent of healing it through a whole food plant-based diet and other strategies and things maybe to limit in your diet or things to and things to avoid. But I I don't have too many patients doing that. I don't hear it very often, but I don't think that it's a practical way. Now, some people fast. I think fasting is absolutely something that
Mm-hmm,
is
mm-hmm.
potentially beneficial for the gut. It is giving your gut that time to kind of rest and digest and heal itself without bombarding it with food multiple times a day, right? Whether it's intermittent fasting, or I know you and I have both done the prolonged fasting, mimicking diet for 5 days. I know there's 5-2 fast, things like that. I think may definitely have had some evidence showing that it can be helpful for health. But colonics and cleanses of that nature, I don't think there's a ton of evidence.
I just
Yeah,
am seeing more about parasite cleanses and um, yeah,
no.
lots of things that I don't understand.
Right, right. And if you have, I mean, if you're seeing a gastroenterologist and you've been diagnosed with a SIBO or some sort of parasite, sure, you need to obviously treat those things, or if you have H. pylori or something like that. But if you are just trying it because an influencer told you to try it and it's going to cure your gut health, I would be very suspicious. Yeah.
So, what are Dr. Sinave's top tips for healing your gut? I mean, how to, because I always like to make sure that we share practical, applicable tips for anyone listening to the podcast. If I'm having some symptoms, maybe don't have a definitive diagnosis, how would you recommend that people look at healing their gut?
Well, I think the biggest thing is you got to look at your diet, right? Now, I do want to briefly just talk about like if you think you have a food intolerance, you can go through it is important to do like a food diary and identify what symptoms you're having and is it intestinal symptoms, bloating, gas, diarrhea, or is it fatigue or rashes or dizziness or brain fog or whatever it might be? And it is okay to temporarily remove a potential food you're eating, right? So if it's lactose or like milk, or if it is, there is a thing called non-celiac gluten sensitivity. You could
Mhm.
eliminate these foods for a couple of weeks, for even 2 to 4 weeks, and see how you feel from a symptom standpoint. Observe your symptoms and then work it back in. I'm not a fan of being off it forever unless you, like I said, have celiac disease or a reason to be off it forever. But work it back in, and then you go, okay, am I still having these symptoms? Did it reproduce in my gut, right? But you can train your gut to tolerate more foods, and just as you would a muscle, right? And I think I've said, you wouldn't run a marathon without training, right? You do have to introduce things into your diet. For example, I'm a good example of this, right? And I eat a lot of vegetables, but I eat mostly cooked vegetables. The other day, I usually get my cruciferous through arugula because some of the cruciferous vegetables get me a little bloated. I had some raw broccoli, a
Ooh,
good
yeah,
amount of it, and
you're gonna feel.
I was wrecked. Like I was like for the rest of the day, I was like, oh my gosh, why did I do that? I obviously do not want to give up broccoli. I will eat it cooked and maybe smaller amounts and working it back in if I want to, but it's just a matter of kind of getting your body used to those foods. I have so many people that tell me, gosh, I don't eat beans because they make me bloated, and trying to talk to them about how they can make it so they don't bother them so much, starting with small amounts, different types of beans, those sorts of things, I think is important. But yeah, my number one tip is eat a variety of plant-based foods, right? We want our gut microbes to work for us. And so we want to try to get 25 to 35 grams of fiber per day. And what I would like people to do is to eat 30 different fruits and vegetables in a week, right? I realize that's not always feasible, but you want to, I think it's a good place to start. Now, if you're already bloated, I generally recommend people start with some of the non-bloating fibers. So like in things like bananas and mangoes and papaya, they have digestive enzymes. So sometimes they can be a little bit better tolerated. Sourdough bread is good, and gradually increasing, avocado is really good. Asparagus is really good, things that aren't going to bloat you so much, like raw vegetables, maybe. And gradually increase the type and variety that you eat.
And so the titration is important, and I think oftentimes we don't think about that it may not be that you need to. So just to recap, journaling, diary, however, whatever term works best for you, you need to document what you're eating and then align it with your symptoms. And then that
Mm-hmm.
way, if you do a short-term elimination, you can see, okay, did my symptoms go away? Yes. But it doesn't mean you have to restrict that food forever. It may mean, let me start with a tablespoon, or let me start with one stalk of raw broccoli and see how that goes. And then start to train my GI tract so that over time I can, if I choose to, I can consume more. But it's
Yeah,
not I don't have to go from 100 to zero and stay at zero forever.
that's right. That's right. And I think it is important to talk about eliminating certain things from your diet or limiting them. If I could give one thing that I wish everyone would do, and I always, yes, eat more plants, but one thing that I would love for people to eliminate in their diet are ultra processed foods, right? And we know, I'm not sure the exact percentage. I think it's more than 50% of the calories consumed in the United States are ultra processed foods. Is that right? And maybe 50 is even low. I don't know.
Yes,
But
yeah.
and we know that ultra processed foods are really causing a lot of problems in the human body. I mean, especially in the gut. And if you think about what is an ultra processed food, right? There's a NOVA classification that I won't necessarily go in, but the least an unprocessed food is pulling a carrot out of the garden and eating it, right? Without even want. Okay, so that's an unprocessed food. But ultra processed foods are those foods that are packaged
Yeah.
pizza, lunch meats, waffles, candy, cakes, cookies. Um, Fast food is ultra processed, right? And so we know that the processing methods of ultra processed foods make them easy to digest, which causes a spike in your glucose levels, which of course makes risk of developing things like diabetes and obesity and that sort of thing. And they're very calorie dense, so high in sugar, salt, fat, and additives, the things we do not want in our gut. So they're lower in protein, lower in fiber, lower in phytonutrients. So all of those things are bad for us in general, but then also the things they add to them, like flavors, colorants, emulsifiers, their function is to really keep it hyper palatable. So we want to keep eating them. And they have a long shelf life because they can sit on the shelf for years
Yes.
sometimes. And we know they have a number of negative effects on the gut, right? And so they have these emulsifiers, and we talked about artificial sweeteners and dyes. They have a profound effect in our intestinal lining. They cause chronic intestinal inflammation. They change the composition of our gut microbiome and give us, dysbiosis, and they damage the gut lining. So things that happen in the gut, or damage to the gut lining and inflammation and increased intestinal permeability. And so we get bloated. So really avoiding, I mean, that would be one of my top tips, would be avoiding ultra processed foods, if at all possible.
And that, well, that brings up a whole nother conversation around the fact that plant-based foods can also be ultra processed.
True. Yes. So whole plant foods are obviously ideal. And I mean, I eat these foods sometimes, right? It's not
Right.
all
Yeah.
or
It's
nothing
not
at all.
never.
It's not right. It's definitely for me, not never either. But I think, yeah, more and more people are going vegan. And I think that companies are responding by making sure they are making some vegan options, which I think are great. I mean, they're good transition foods, but you don't want to have an entire diet full of ultra processed vegan food. You need to have some whole plant foods in there, for sure. And yes, of course, we're going to have the snacks and the treats and things, occasionally, but it should not be the primary element to your diet.
It's not 3 meals a day. Yeah.
It's not right. Exactly.
And if it was, there's no way you could get to 30 different types of foods, which
Yeah,
can include spices, I think.
that's right. Of course, spices are a great thing to incorporate into your diet for sure.
And it'd be interesting, and you may not know the answer, but do you have a sense from looking at the food diaries of the patients coming into your clinic, what's the average amount of fiber that the Chicagoland people are actually consuming?
That's a great question. Oh my gosh, it varies. You know, it's funny because some people will be like, I eat a great diet. I eat chicken every single meal, or I eat eggs every single, or eggs every morning, chicken for lunch, and I'll have a small piece of steak for dinner and some vegetables on the side. So yeah, I mean, and I have that conversation, well, fiber is the most important thing, and fiber comes only from plants. So, trying to, again, you have to meet people where they are, but just talking to them about incorporating more plants and maybe less meat and dairy and eggs, and I think a lot of people know that ultra processed foods are bad for them. And so they're mostly trying to avoid those. And so, but then maybe they're still not getting enough fiber in their diet because they are reliant mostly on animal foods, and that are not necessarily, doing them a lot of favors for their gut either, because they're just not getting enough fiber in general.
I, I was talking to the Thrive on Plants community the other night and talking about that fourth macronutrient, which is fiber.
Yeah.
We should be tracking it just like we track our protein, our fat, and our carbohydrates. Why not track our fiber?
Right. Or even diet. Like I know Dr. Katz says diet should be is a vital sign, right?
Right.
And we have to find a way to screen for that in our practices in a efficient way, But I talk a lot about it, but I do think it is something that doesn't get enough attention for sure.
Erin, I know
Yeah.
you also see little peoples in your office,
Yes,
for kids.
for sure.
For parents that are listening, what can we do? So I worry about the next generation a lot
Mm.
because they are eating more ultra processed foods. I have no idea what the health of the microbiome is for these kids. They're not getting the healthiest foods in school.
Mm.
Do you have any advice that you give to parents, and you're a parent, in terms
Mhm.
of how do I help my little kiddos learn to love these foods now, and
Mhm.
so that are set up to be as healthy as possible going forward?
Yeah, such a good question, and such a tough thing to navigate for parents for sure. And I will say every day I have patients come in, and parents are like, they're a picky eater. They're eating chicken nuggets and mac and cheese and
Chicken.
that's French fries. And that's about it. And it's sad. I mean, because it is, you want your kid has to grow and you want to feed them, but they're refusing certain foods. And it's definitely a challenge. And I mean, the one thing I know is the younger you start, the better. And keep it in their diet. And you can make plant foods palatable. And I mean, and they do have, it was funny, just yesterday, one of my patients, a little, I was seeing her older sister, but this little girl was in there and she was sucking on a pouch, which I, and I was like, what's in that? It was like spinach and beet and
Yum.
apple to make it taste good. And I was like, oh my gosh, that's so great. They make these things. They didn't have those when my kids were growing up. But I think, you know, just talking to the parents about, you know, the importance of a variety of fruits and vegetables every single day, and just trying to add more things. And it's you don't want to necessarily restrict. I don't always like to talk about things like weight or, you know, but I do like to talk about, you know, a healthy gut, healthy microbiome, as well as, you know, just getting some fruit and vegetables into them. Smoothies are a great way to do it. That's how I used to get spinach in my kids when they would were going to school. So I'd say that a lot. You can throw so many foods into it, and I'll be like, at minimum, my child is getting this green smoothie. It has a little bit of, you know, has a bunch of fruit. It has got a ton of spinach in it. And at least I know they're getting some of that every single day. When then, you know, I used to pack my kids' lunches, but I know that's not possible for everybody. And so, you know, they're going to eat what they're going to eat at school. Of course, you can educate them on healthy choices. But I think just prioritizing your own health as a parent and also will help them follow suit as well. And not just that, getting them outside, again, getting outside, getting exposed to nature, having them run around, and, you know, not be, you know, exercise. We know exercise is great for gut health as well. When it comes to food allergy prevention, one of the things that you're making me think about is, you know, there's evidence that really shows that that a mother's microbiome in pregnancy can, you know, the dietary diversity is promotes better immune system in the developing fetus. And so we know that maternal microbiome may actually play a key role in preventing allergy prone phenotype in some patients. And we know that a high fiber diet has been shown to prevent food allergy in mice, actually, interestingly enough. We don't know exactly how it may translate to humans, but there's just a lot of research going around about just allergic disease. And we know that people that eat a more Mediterranean style diet tend to have lower risks and lower symptoms of asthma and allergies. And those that are eating more processed foods do have more uncontrolled symptoms of asthma and allergies. So I think, again, a lot of this probably goes back to the gut, but it is important to highlight some of that evidence, I think, for people, and just, you know, do their best, because it is hard. And especially in a world where, you know, corporations make these foods that are hyper palatable, and then they don't want to go back to the
Yeah.
other fruits and vegetables that are so good for us.
And I want to be respectful of your time because I could talk to you forever.
Okay.
Just one last question related to kids. When I was growing up, it was probably one, maybe two children in the classroom that had a peanut allergy. Are are we,
Mhm.
is testing just more sensitive, or has something changed? And I'm assuming it's environment and food that we're seeing so many more kids with allergies. And I'm asking because I was talking to a mom the other day who was talking about getting her son allergy tested. And I'm like, this wasn't a thing when I was little.
Yeah, yeah. No, you're right. We have seen, certainly there's been an explosion of allergic food allergy for sure over the past 20, 30 years. And what happened, and I don't want to get too in the weeds, but what happened back in the early 2000s, or I think it was like 2000s, the American Academy of Pediatrics recommended no peanut till age 3, no milk till age, you know, so they recommended not introducing allergenic foods early. And and that led to a spike in allergy. And they just did it just because they were seeing some more food allergy, and they were nervous, I guess, but it wasn't based on evidence, unfortunately. So now we've had the LEAP trials, which are early introduction of peanuts specifically. And now the recommendation is early introduction of allergenic foods around 6 months. For
Mm-hmm.
those with eczema, they're even higher risk because they can become sensitized through the skin, those skin cuts with eczema. So they want even 4 months early introduction of like nut butters and diluted and things like that. So that's for prevention purposes. But I think in general, yeah, there's a lot of theories as to why. We don't know 100% why, but that was kind of one of the reasons why. But we do think that just our environment in general has become so sanitized. There's less time outside. And again, we know that over time in the general population, the gut microbiome has changed. It's definitely not what our ancestors had, right? And so it very well could be a big part of it, just that decreased diversity in our gut leading to more allergic disease in general.
Which is fascinating. But it doesn't mean that has to be how it needs to be going forward.
That's right. That's right. I think that's true. And I think, and I mean, again, I don't want to get too food allergy driven, but if you're a parent with a baby, an infant, that early introduction is important, but also really good skincare, interestingly enough, with eczema, because eczema is a route of sensitization. So again, if your baby has terrible eczema, could be that they're allergic to an animal in the house or something too, but you want to keep their good skincare. And of course, they can always see allergy if they're worried about introducing. They can come and see an allergist. But there is a lot to be learned in food allergy in general, as well as food intolerance. But it's definitely just something to keep in mind.
And with all of the different chemicals in our food, I'm sure you will be in business for a long time.
I think so too. Oh gosh, I'd love to be out of business, but no, it's fun. I really love what I do for sure.
Erin, I'd love to wrap up today with a little bit of a lightning round of questions. These
Okay.
aren't yes, no.
Okay.
Some of them are single words, some of them may require a little bit of an explanation. But what is your go-to prebiotic meal?
Mm. I love a good salad once a day, at least. I get a good hearty salad. Usually it's for lunch. So leafy greens. I like to have arugula, like I said, so I get some cruciferous veggies in. I will sometimes, not always, but sometimes put sauerkraut on it. So I'm getting some fermented foods too. I put usually some nuts, maybe dried cranberries, and a balsamic dressing, which got a little vinegar, which is good for the gut too. That's probably my best meal. Yes, for sure, for my gut.
And maybe some raw broccoli. No.
Oh, raw broccoli. Yeah, maybe just a small piece once a day or something.
I have the same issue with raw broccoli. So,
Oh, okay. Yeah. Yeah.
if you had to recommend one supplement for gut health, what would it be?
Oh gosh. Um, I think you always want to start with food. Always start with food. That's first and foremost. But if you want to try something because you are bloated or having constipation or GI upset or what have you, I think there appears to be some benefit to taking a probiotic supplement in healthy adults. But what probiotic you choose is certainly important. Generally, we recommend the probiotic is at least 50 billion colony forming units or CFUs and multi-strain. So usually more than one type of strain in there. I don't take a probiotic or prebiotic personally, but if I were on an antibiotic or on a PPI, I might think about it. And you might know this better than me, but I know I do take creatine daily. And I think there's some evidence showing creatine is also good for gut health, right? I
It
believe
is.
there is. Yeah. Okay. I mean, it's good for a lot of things, but I think it does impact our gut too. So that I do take every day.
And there's a whole, was it March or is it coming up in April? There's a whole conference on creatine that's being hosted. Yeah. Um, and so I'm excited to hear the output of that conference. But gut health is one of the things that I know is being discussed at the conference.
Yeah. Okay. Well, good. I need to tune into that for sure. Maybe you should do a summary podcast on that so we can
I
all learn.
I would love to.
Okay. Excellent. Ah.
What is one non-negotiable practice you believe everyone should adopt to maintain good gut health?
Um, I mean, I honestly, everybody would improve their gut health if they avoided ultra processed foods. I mean, I know that I don't want to make it about avoiding something, a practice avoid, but I really think that that is doing so much damage in our everybody's health, not just gut health, but for our brains and for our cardiovascular system and our hearts and our livers. If we could avoid ultra processed foods, that would be number one. But also incorporating more plants into your diet for sure.
More plants, less ultra processed.
That's right. That's right.
And what's one myth about gut health that you wish every person knew?
Um, I would a myth that I wish did not
More
exist
people.
was that gluten is bad for you, for everyone, because it's not.
That that's a big myth. Yeah.
That's a huge myth. And so, I mean, again, gluten, people often feel better after eliminating gluten because they're eliminating ultra processed foods in the
Uh-huh.
process, right? But whole grains are good for the majority of the population. And it's so that's a big one, as well as the beans thing. Like, oh,
Oh,
I
the
can't
beans.
eat beans because they cause me to have gas. Because
Right.
beans are like a superfood. So, yeah, those are the two probably. I know you only asked
Gluten
for
and
one,
beans.
but
Nope. I think they're both good ones because we hear them a
okay.
lot. What's next for you in your career? Do you have any upcoming projects, publications, something that you're excited about that you want to share with the community?
I'm I love learning. I am planning on attending an allergy conference this year. I'm planning on attending the American College of Lifestyle Medicine conference this year. I don't have anything being published in the pipeline, but I just always am going to try to stay on the pulse of the research surrounding gut health, especially as it pertains to GI and the food intolerance piece, because again, I think we know the tip of the iceberg on gut health, and I think every day there's new research showing how important it is to our overall health. So staying on
Lots
top of
of
that
love.
for sure. Yeah.
And then final question, what does it mean to you to thrive on plants and live with purpose?
Mhm. Good question. I think purpose. I mean, to live with purpose, I think purpose is the thread that ties together like meaning and joy in our lives and the impact we can have. And I think just using your talents and your expertise in a way that can be potentially life changing or just change one habit today, I think that's what living with purpose means to me. And also knowing that your worth is not tied to productivity. I think
Mhm.
rest is important, play is important, giving your mind time to just slow down is important, especially in this world. So, giving myself permission to just live and do nothing and explore and let purpose more unfold as a journey versus a rigid, destination, I think is important. So,
I love that. That's awesome.
yeah.
Erin, thank you so much for joining Thrive on Plants. This has been an amazing conversation. Where can people find you if they want to learn more about your practice or to connect with you?
Yeah, I'm on LinkedIn. That's probably the best place to find me. I'm also on Instagram, but that's more just kind of a personal page for me. But yeah, you can certainly find me on LinkedIn.
Well, I'm sure there are people who want to, especially if they're in the Chicagoland area, would love to connect with you and become part of that community that you're trying to build for men, women, children who are learning how to thrive on plants and live with purpose. So thanks for
Mhm.
joining me today.
Well, thank you, Daphne. It's always a pleasure.
Thank you for joining us on the Thrive on Plants podcast. I hope you are walking away with a deeper understanding of how food reactions impact our bodies, and more importantly, how you can support your gut health in a sustainable and plant forward way. Again, I want to send a huge thank you to Dr. Erin Sinnaeve for sharing her expertise, her passion, her energy, and for busting some common myths and giving us some practical tools to feel our best. If you love this conversation and want to dive in deeper to gut health, be sure to connect with Dr. Sinnaeve on LinkedIn. She's an incredible resource for science-based practical health advice. And of course, I would love to hear from you too. What's your biggest takeaway from today's discussion? Tag us on social media, share this podcast with someone who you think would benefit, and leave a review. It truly helps us to bring more content that you love. And if you haven't already, make sure to subscribe to Thrive on Plants podcast so you never miss an episode. And you can also join me in our community, thriveonplantslife.com. We've got some incredible guests coming up who are going to inspire you and empower you on your plant-based journey. But for now, until next time, keep thriving on plants and living with purpose. Take care. The content provided in this podcast is intended solely for informational and educational purposes. It's not designed to replace professional medical advice, diagnosis, or treatment. While I'm a doctor, I'm not your doctor. Always seek the guidance of your physician or other qualified healthcare provider with any questions you may have regarding your health, medical conditions, or treatments. Our goal is to provide accurate and up-to-date information. The discussions and views shared on this podcast reflect the opinions of the host and guest, and they may not align with your unique health needs. Decisions related to your health and wellness should be made in consultation with your healthcare team because they understand your specific circumstances. Thanks for joining us on this journey to thrive on plants, and I hope you enjoy the future episodes.